My name is Scott Smith. I work emergency medicine in Florida. Although I've been working in the States for about 20 years, my passion is using my skills as a physician working in underdeveloped countries. I've traveled to many different countries with medical teams, including Guatemala, Nepal, India, Cambodia, Haiti, and Brazil. In 2010, I went with a group of nurses and other volunteers to Kimana, Kenya, to provide medical care to the Maasai. This is where I met Ken and Sandy Taylor. The Taylors have been missionaries in Kenya for over 20 years and had recently started a school in Kimana and were our hosts for the trip. We spent 2 weeks in Kimana traveling to remote villages and providing medical care. Since that trip, I've been returning on a regular basis to work with adventurous physicians, nurses, medical students, and others who want to volunteer their time and skills. After our initial trip, the Taylors asked me if I'd be interested in helping them to start a hospital. Now, building a hospital was never on my bucket list of things to do, but here I found that there's a great need for one. When we travel to the villages to provide medical care, we have to bring all of our supplies and medical equipment. However, we're not able to meet all the needs with our limited supplies. Some patients that come to us are in need of a higher level of care that can only be provided in a hospital setting. A few years ago, a modern highway was built going through the town of Kimana. Last year, electrical power was brought in. This was once a small, sleepy village, but with these additions, there's been an explosion in the population. The growth of the area has brought concerns with the level of sanitation and availability of clean drinking water. Where there was once just a dirt road traveled by a few trucks and safari vehicles, there's now a constant flow of minibuses and motorcycles. Motor vehicle accidents have become a daily occurrence. Besides the motor vehicle accidents, there are traumatic injuries from knives, spears, animal attacks, and burns.
Maybe a week ahead of time. They checked it also. And they took no wheel drive it. Now, did they put this on here?
Some of the common medical conditions often seen include cutaneous anthrax, goiters, lice and scabies infestations, malnutrition, malaria, tuberculosis, and HIV. Kilimanjaro Mission Hospital will allow us to better provide care for the local population, where outpatient treatment would not be appropriate. The hospital will be staffed by local nurses and physicians, as well as visiting volunteers and medical specialists. The property for Kilimanjaro Mission Hospital has been provided by the Taylors organization, Bible School International, and lies on the outskirts of the town of Kimana. Architectural designs have been approved and a deep water well has been surveyed. We have purchased a diesel-powered cement mixer, a brick maker, and a commercial tent to be used to house the workers and supplies.